Hello, good evening. My name is Mark. I'm a family nurse practitioner student with United States University, and I'm here to do um, a health history video. And let me do a 360 of the room before we start. I do a 360 of the room. Okay.
Come on in.
Good evening, Mr. J. How are you today?
Good evening. I'm doing good.
Okay, let me sanitize my hands. My name is Mark. I'm a family nurse practitioner student with United States University. And I'm here to do your health history with you. And I would like to know if you give me a full consent to do this interview with you, and if you give me authorization to post this video on YouTube, but it's gonna be unlisted. Do you give your consent?
Yes, I do.
Okay, let's start. Would you please tell me your name, your initials?
CJ,
Okay. What is your date of birth?
February 10, 1971,
Okay. What is your age right now?
52.
53. Okay. So your ethnicity is
Black,
black. Okay. How do you identify yourself? As female?
female.
Okay. So okay. How did you come to the clinic today?
I drive myself in.
Good. So did you come with anybody with you?
No, I was by myself. I just drove in
Okay. Good. So what's bringing you here today?
for a physical.
Wait. Please go. Okay. Do you have any health history problem? Any
I was diagnosed with diabetes,
okay, diabetes? Mm-hmm.
and
So that's why you have those medications?
yes, this
Okay.
is what they prescribed me.
Okay. So when did you have that diabetes?
More than 10 years ago, I was diagnosed with diabetes.
Okay. And did you get your blood sugar this morning?
Yes, it was 124,
Mm-hmm.
and like you can see, they prescribed me
Yeah. So what about your A1C? When the last time that you take it, what was it?
6.8.
6.8.
It
How long ago?
was 6 months ago.
Okay. So I see that you are on metformin and glipizide.
Yes,
Okay, that's the metformin is 1,000 milligram twice a day, and the glipizide I see 10 milligram
once
once
a day.
daily. Okay.
Yes,
Oh, okay. So how tall are you?
5'5",
Okay, 5'5". How much do you weigh?
220.
220. Okay.
I know that I'm overweight.
Yeah. Okay. You're overweight.
And my primary care doctor said that to help me with the diabetes, I need
Mm-hmm.
to.
You need to do some exercise to
Yeah,
maintain.
to
Yeah.
lose weight.
Okay, we'll get to that. Okay, so do you have any other health history like past surgery or any other problem?
Yes, I had fibroid and I
Mm-hmm.
had two surgery.
Had two surgery. How long ago?
More than 10 years. I
More
do
than
not remember the
okay,
date.
more than 10 years ago. Okay.
Yes,
Any other problem?
not that I remember. Sometimes iron deficiency because I lose a lot of blood when I have my period. I have heavy
Okay.
period. That's it.
So are you currently on iron or you have iron when that
I
got you?
had the iron, but the problem is, as soon as they check my iron level and it's level,
Mm-hmm.
they stop it. And
Okay.
I also take vitamin D twice a week.
Okay, that's the OTC medication that you take twice a week. How many units do you take?
I do not remember.
I do not remember. Would you mind to call the clinic and to tell
Okay,
us,
I
call us
will.
when you get home and tell
Sure.
us, okay, about the units? Okay. Do you have any history of asthma, hypertension?
Nothing else other than the diabetes.
Mhm. What about your family? Um,
In my mom's side, my mom had uh, cancer
mhm.
and she died from it.
Okay.
My grandma had high blood pressure.
Mhm,
My grandpa was healthy. In my dad's side,
mhm.
I had the brother that used drug and alcohol.
Okay.
My dad, he's not a heavy drinker, but he socializes himself with his friend and sometimes takes some alcohol. And he has high blood pressure, diabetes,
Mhm.
kidney disease, heart disease,
Okay.
and he died from a stroke like at age 69.
Mhm.
But myself, I never drank, never smoke, and no coffee, no alcohol. That was the same lifestyle for my mom also.
Okay. So, do you have any food allergy or drugs allergy?
No food allergy, but I had oxycodone once that they prescribed me, and the
Mhm.
first pill that I take, I vomit a lot.
Okay.
And since then, they keep me away from that medication.
Okay. When that happened, so it's did it make you dizzy to just vomit only?
Vomit,
Mhm.
dizziness, and I have to stay in bed for the whole day.
Mhm.
And since then, they put that I'm allergic to it, and they do not prescribe me anything with codeine.
Okay. So that dizziness and vomit. So what relief that?
The symptom,
Mhm.
I drink water, and when I feel like I was able to eat a little bit of food, and
Mhm.
it ease the
Okay.
sensation.
Yeah. When you had, you said that you had surgery
Fibroid.
for the fibroid. Was it laparoscopic or did they open you or did they
There
do
was no
vaginal?
opening. They did it like they are doing a sonography for my vagina. That's it.
Okay. 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 Um, what about immunization? Did you get the flu vaccine this season?
I didn't get the flu vaccine, but I get my COVID vaccine, and I'm
Mm-hmm.
all set with other immunization, major
Okay.
immunization. But I refuse the flu vaccine, not because I'm allergic to it,
Mm-hmm.
and I do not feel that I need it.
Okay. So do you have any allergic reaction with the environment or any? No,
No.
that's all. Okay. Okay. Any of your family has allergic
No, first, no,
history?
no,
No. Okay. Okay. And you said that you don't have any history of alcohol, no
no,
drugs, recreational drugs, and you don't drink alcohol, coffee.
no
Okay.
alcohol, no coffee, no cigarette.
Okay. So what about red meat?
It's part
So
of my diet.
it's
I
part
do
of your
not
diet.
take it
Okay.
every day, but
Mm-hmm.
my diet is made with rice, bean,
Mm-hmm.
cornmeal, meat. When I say meat, it could be red meat, it could be chicken. You know,
Yeah.
it's part of the way we are eating in my culture. A
Yeah.
lot of vegetable, a lot of carb, unfortunately.
Okay. Do you exercise?
Not enough because the way I'm working, I spend a lot of time sitting in front of the computer,
Mm-hmm.
and unfortunately, I pay a gym subscription, but I do not. go, and I'm working on that to
Yeah.
improve that.
Okay, what kind of job do you do?
I'm working to help family. I'm in the financial field. I'm working helping family get out of debt, become financially independent, and if they want to make some more money, teach them how to do that. I help them to be on track for their retirement. Those kind of
Okay, that's good. So that's it, that you spend most of the time sitting and
Yeah,
yeah. So how many times a week that you work? It's recommended that you like moving like for
I
30
need to
minutes a
do a
day.
better job
Mhm.
in that, and I do not work enough, but I sometimes go out and go to the store or work just to see if I can put
Mhm.
some exercise, but I could do better, and I'm working on that.
Okay, that's good. So sexually, so what, you married, you said?
I'm married, I'm sexually active, and I
Okay.
only have one partner.
Okay, do you use contraception?
No contraception, no preservative.
Okay. For the past 6 months, you just only one partner
Forever.
forever. Okay.
Since I'm married.
Okay. And also, um, is your, like, do you test for any STD
I think that
recently?
they did, not recently,
Mhm.
long time ago. I think they did it for me back home for school, but not
Oh, okay,
exactly.
okay. What about your partner? So does he um do any have any STD test current?
I know that he has an SCT test done, and everything was fine.
Okay, okay. And so you had that C-section. Oh no, I mean you had that fibroid done. Did you have any C-section history?
No, I have two miscarriages, but those not C-section.
Okay, okay. Good storage. So what is your military status? Do
No, I do not have any miscarriages.
okay. So where do you live? In apartment or house or
Apartment.
apartment? Okay. So do you have any kind of religious affiliation?
Yes, I'm a member of the Church of Jesus Christ of Latter-day Saints. And
Okay.
spiritually, everything is fine.
Okay. And also, do you have any safety problem at home? Do
No,
you
I
feel
feel
safe at
safe.
home? Oh, you
Yes.
do? Okay. Yeah. And while you're driving, do you use seatbelt?
Yes. To most safety.
Okay, good. What about texting
I
and
do not
driving?
text.
Okay. Do you own a gun at
No,
home?
I do not need one.
Okay. Do you have a pool in
Not
your?
yet.
Not yet. Okay. So that's when you plan to have one day.
One day.
Okay. And when you have it, it's always good to put a gate on it to keep children from going in there. Put a gate and lock it
Mhm.
to keep children from going in there without unaccompanied.
Okay.
Okay. How is your ATL? So do you move very very well? Are you
Yes.
moving?
Yeah.
Okay. Okay. Good. Good. And okay. Let's go with your eyes. How is your eyes? So I
I'm
see that you have
reading
glasses.
glasses
Mhm.
because my it's not easy for me to read without the glasses, but I do
Mhm.
not use it when I'm driving.
Okay. Do you see floaters
Only when
on
I'm
your eyes?
hungry.
Only when you are hungry? Okay. Any itchiness,
No,
burning sensation with your
no.
eyes? Okay. No. Okay. And is your prescription correct
Yes.
for this? Okay. Any problem with your ears?
No.
Do you hear some kind of ringing sound
No.
sometimes? Any history of ear infection?
No.
And
No.
any problem with your nose sometimes?
No.
Like patency of your nose? Like if you close your eyes and you put something, you can identify the scent of it?
Sure.
Okay. No history of nosebleed, right?
Mm-mm.
No.
Only if the heat is too high, yeah.
Is it like profusely bleeding or how?
No. Just you can blow and a little bit of.
Skin or blood? Okay.
Mm-hmm.
Just when the heat is too high. Okay. And any history of throat problem with your throat?
Mm-mm. Only if I have a cold, but
Mhm.
usually when I have cold, it's gone quick.
Okay. Any history of gum bleed?
Mm-mm. I'm fine with
You
that.
fine?
No.
Okay. When was the last time you visit your dentist?
Dentist
Yeah,
last year.
last year. Okay. You haven't gone this year for any clinic yet?
No.
Okay. Well, it's recommended like to do that at least twice a year.
That's true. I need to take an appointment.
Yeah, twice a year. Um, okay. You don't have any problem swallowing,
No.
chewing.
No.
Okay. Any respiratory problem?
No.
Any any people, any person in your family or extended family, your grandpa, your grandma?
One uncle has lung cancer
Mhm.
because he was heavy smoker. That's it.
Okay.
Smoke a lot of cigarette.
So he died now
From it, yes.
from it. Okay. At what age?
In his, let's see, late 60.
Okay. Yeah. Any problem like nausea, vomiting?
No. Only when I had that oxycodone.
Okay. Any problem like with stomach ache?
No.
No. What about your bowel movement? So how do you
Everything is fine.
every do you go daily or every other day
Daily,
or daily?
yes.
Soft
Twice a day.
soft form or
Normal for me.
okay? Huh?
Normal.
Normal? Okay. Yeah, so do you have any history of diarrhea, constipation?
Not a really stewy. Maybe I ate something just doesn't go well,
Okay.
but not.
Yeah. Okay. And you said that you had fibroid and also and did the surgery for it. So when you pee, do you have any burning sensation?
No.
Any do you force yourself to pee sometime when you have
No.
to pee?
No.
No. Okay. Your period is it regular? You said that it's
It's
kind of
regular
coming
but
heavy,
heavy. That's it.
regular, and you're still having your period.
Yes.
Okay.
At 52. Still
Yeah.
having it. I don't know why, but it's still there.
Mhm. And you said that you have do you have any history of miscarriage or anything?
Yes, I had two miscarriage.
Okay.
That's
Okay.
it.
Yeah. You don't have any children?
No.
No. Okay. Yeah. Okay. Do you have any pain in your muscles, muscle ache?
No.
No. Okay. Any bone pain sometimes?
No.
No. Okay. Any problem with your skin?
No.
Any rash?
No.
Stomach rash? Okay. Any itchiness?
No.
Okay. What about the breast? So do you have any kind of lumps somewhere?
Nothing. And I had
Mm-hmm.
mammogram done
Mm-hmm.
regularly
Okay.
as prescribed, and everything is fine.
Okay. When was the last time you had mammogram?
I think it's 6 months ago.
Okay. So it's always good to check yourself sometimes for lumps
I
while you are
did
taking a shower and
shower.
then put your arm up and then to do some kind of palpation and touch,
I try.
the sides, both sides.
Yes.
Yeah, that's good. So, do you have any history of anxiety,
No.
side problems in your family or any?
No.
Okay, so any kind of stress sometimes?
Who live without stress in that world?
Yeah,
But nothing to
but what relieves your stress when you have stress? Like, how do you cope with stress?
reading the scripture, praying, do
Okay,
something fun, and move on.
okay, yeah. Do you have any history of blood clot?
No.
Any lymph node swelling?
No.
Okay, yeah. Okay, and you are diabetes, and then one has endocrinology, endocrine things that you have diabetes. So after that, and you are on that metformin and the glipizide,
Mhm.
and that won't be enough for you. You need to do some exercise too, weekly. I mean, kind of daily if
Yeah,
you can, yeah. So, or 3 times or 4 times a week if you can. That
I'm
would
working
help a
on
lot.
that and I will
Yeah,
change my diet too.
yeah. Change your diet because of your weight and your height and weight. So, well, when people have diabetes and then they kind of overweight or obese, so they have a lot of chance to have heart problem. And in your family, um, your dad had heart issue, so it's very easy for you to have that too.
Okay.
You know, yeah, and you don't want like to have high blood pressure with all of these, and you don't want to have any other problem.
Sure.
Yeah, so exercise will be a good thing for you.
Okay.
Okay,
Thank
so thank you for coming, and I appreciate your time.
you. And I will see you next time.
Okay, and the clinic will be always open for you,
Thank you.
and your family nurse practitioner Mark will be always be here for you. Okay,
Thank you.
have a good one.
You too. Bye.
Thank you. Bye bye.